Welcome everybody to the Institute of Health and Social Care Management's latest in its Greener Care conference series. We've had various of these over the last couple of years during the pandemic, always very well attended, always fantastically interesting, particularly in respect of some of the innovation that's on display. What I want to really set up for you today is why we're here. The reason we're principally here is to address the entire topic of environmental sustainability and carbon reduction, particularly with an eye, of course, to the advent of integrated care systems and the fact that this has to be a collaborative process through both health and social care. Of course, one of the big things that everybody has their eye on at the moment, or they should have their eye on at the moment, is delivering a net zero NHS and social care, I would suspect, by 2040. That is a mandated process that the government has committed to, as indeed has the NHS in England. Excuse me. And it's going to be fascinating to see how we evolve towards that, as I say, with the advent of integrated care systems and indeed with the advent of some of the financial restrictions that integrated care systems will be placed under, certainly if reporting today from the Health Service Journal is anything to go by. So I think one of the big challenges is going to be how we maintain greener care, environmental sustainability and net zero carbon emissions at the top of an NHS and social care agenda, given all of the activity currently threatening to take people's priorities elsewhere. That might be to do with gas and oil contracts as a result of the ongoing situation in Eastern Europe and Russia. It may be as a result of financial pressures being applied as we recover from 2 years of pandemic activity. Who knows what might be up there that will put different priorities in front of leaders within health and social care. But I suspect one of the key elements will be how we maintain this environmental focus. I'm delighted that Elaine has made it here. Elaine Mead, who some of you may or may not know, is chair of our Greener Care Special Interest Group at the Institute for Health and Social Care Management. Elaine, I'm so pleased that you could join us. I've just given a little bit of an overview, which I think you heard. Would you add anything to that, do you think, or am I just about on the right lines here? This is a matter of preserving the priority.
Absolutely, John, and I'd completely endorse everything you said. It is an absolute priority for you, but I may have an answer for you about how we're going to preserve that priority, because with our members and the partners that we work with, actually, we now have a huge number of people who are enthusiasts, who are activists, who are passionate for the environment and passionate about the planet. And I guess the Institute can bring them together as part of our Green Care group. And I'd be very keen to have more people join us after today to talk about these issues and see what we can do, not just from influencing a policy level, which I'm sure we will be able to do, but also in a very practical way. What can I do? What can I do personally? What can I do professionally? So it's time really to help people take some action. And I'm sure lots of people are up for doing that today.
Thank you, Elaine. Well said. I have put in the chat there for anybody that may not have yet seen it, the NHS England Net Zero NHS plan, because that still bears a huge amount of relevance, and it is the plan that people are looking at within certainly the health sector. I would really hope that they extend it to social care as well, and who knows whether they will or not, but we'll see how we go there. Listen, before we go any further, we had the most sensational, slightly idiosyncratic, but sensational all the same, karaoke night last night for Institute members. If you weren't there, you missed an absolute treat and a hoot. But the lady who led the karaoke session is called Gale, and she wrote a song during the pandemic that did rather well. And we thought we might play it because its title is Let's See What the Earth Has to Say. And I think it's a rather nice precursor to the rest of today's conference. So Jade, if you're primed and ready, could you press the appropriate buttons?
all your money to make yourself happy. Material helps everything. Your friends all adore you, your family are poor, but you're living your life like a king. Then the world stops for a moment and you don't know what to do. And you're locked up at home with the things that you own. Everyone that you know is online. And you're binging on box sets to help you forget your fear and our fragile mankind. Then the world stops for a moment and you don't know what to do. And it just goes to show that we really don't know how much changes in one single day. And we don't really need what we think that we need. Let's see what the earth has to say. So you hope and you pray when the news people say if the world may get better one day. Though the birds and the bees, they are filling the trees, and the sky's so much bluer today. Then the world stops for a moment and you don't know what to do. And your heart skips for a moment. Do you think they'll even pull through? And it just goes to show that we really don't know how much changes in one single day. And we don't really need what we think that we need. Let's see what the earth has to say. Though the birds and the bees, they are filling the trees, and the sky's so much bluer today. And the birds and the bees are filling the trees. Will we change enough to be safe? Let's see what the earth has to say.
What do we think, folks? There's a bit of applause going. Wasn't that delightful? So now you're all thinking, gosh, I wish I'd been at the karaoke session with the IHSCM on Wednesday evening. There will be another one. I'm thrilled to be able to tell you. We will be doing that again. But what I thought we'd do now is just revise this purpose of the conference business. We've clearly got these competing priorities that are going to be coming up the agendas. I felt it was worth us just pointing those out at the beginning here. Elaine has confirmed that that's where we'd like to take this, but we've got a good audience here today. Has anybody else got anything they'd like to particularly get out of today's conference event? I would say that we've made a deliberate effort today to ensure that we provide some practical lived experience examples of real-time efforts that are being made in respect of environmental sustainability and carbon reduction. But has anybody got anything that they're particularly looking to get out of today? And we try to make that happen if we can. Do feel free to unmute if you have a view. So this is your opportunity for interaction, if in case anybody was wondering. And there's me thinking this was going to eat up about 5 minutes of time. Well, look, Elaine, what I suggest we do is, in that case, I'm going to move straight ahead because I think we've laid the ground quite nicely for this now. I'm absolutely thrilled to be able to welcome Darin Halifax, who's the Integrated Care System lead for the voluntary, community and social enterprise sector within the Integrated Care System for Devon. Woohoo! And the reason I give that woohoo is that, of course, the ICS for Devon is our first ever ICS appointed as a regional hub for the southwest of England. We are absolutely delighted that we've reached agreement in that regard. And Darin, this is a big moment because you're the first ICS for Devon person to feature in one of our conferences. Darin is going to be talking about the ICS for Devon's green plan, Devon's journey, I think you describe it as, Darin. Do you want to just, have you got some slides you're going to share, or are you going to just...
No, you've just got my lovely West Country accent instead.
We can't wait to hear it. Well, look, tell us a little bit about, could you just start off by just explaining for people who may not be entirely familiar, can you give an understanding to us of what the ICS for Devon is? What's its geographical scope? What does it include or exclude, for that matter?
Sure, no problem at all. Hi, everybody. Lovely to virtually see you all today. Yeah, Devon's the third biggest county in the UK in terms of geographical spread. It's got two cities, Plymouth and Exeter, but it's mostly a sprawling rural environment with some coastal towns, some market towns, but the vast majority of the space is Dartmoor, Exmoor, etc. So it's a difficult place to get around, which will give you some clue about how I'm going to be talking about our green plan in a minute. But it has four trusts, four foundation trusts, one mental health trusts, 3 different local authorities, and a single CCG. So it's I think it's atypical pretty much of other ICS trusts in the country. And the reason why I was asked to do this today is because I'm no green expert at all, but I'm a massively happy amateur. But I do have experience within the CCG and the ICS of bringing together partnership plans, and we very much saw our green plan as a partnership plan.
So could you help us to just understand the ICS was formally put together about a year ago? Would that be right, or 18 months ago?
Well, we've had a shadow ICS now for about 6 months. We don't actually become an ICS officially till the 1st of July. So
yeah. When did the impetus for the green plan for the ICS first come to shape?
Quite recently, John. So about 4 months ago, we started seriously thinking about it. So about November time, probably, where we suddenly thought, oh, crumbs, that deadline's getting close, isn't it? We need to do something about it. We don't have a sustainability lead for the ICS as such, but we have lots of people with massive ambitions and massive experience in different worlds, but we also have sustainability leads in all of our trusts and in the local authorities as well. So our journey started really with conversations with those sustainability leads, and immediately the first thing we thought of is, this is danger. This is going down a bit of an estates route here, and will it be owned by the staff? Because we want everybody to feel as though they've got a part to play. So the original plan, we thought, he said laughingly, we could just amalgamate all the trust plans and all the local authority plans, and Bob's your uncle, job done. No way. Absolutely no way. Because
can I just ask, did all of the trusts and the local authorities, did they have what you or I would call a sort of mature, clear, convincing greener plan in their own right, or was some more advanced than others? Would it be fair to say?
Yeah, mixed ability class, I think it would be fair to say. But all of them with massive impetus and ambition to do something, but some are much more advanced than others. So yeah, it was a bit of a mix and match. But having said that, of course, the trust responsibility was to have a plan in place, which they all managed to do, which is great. So yeah, we thought, let's get the plan merged together. We can do something with it then. But after many conversations, I think we put it then to the staff and said, look, this is what we think this might look like. We ended up with 87 different actions. And the 4 things we got back from the staff was, this isn't an ICS plan. This is a TK max of a plan where you've got everything, but nobody owns it. We're going to do this anyway, aren't we? Each of the component parts are going to do this anyway. So this isn't an ICS plan. There's no ambition here, and it's too big. It's way too big. It's not something that we feel as staff we can own ourselves. So when we're talking, and also many of our staff said it was too technical. That it was massively technical questions about medicine, nitrous oxide, etc., and staff were very honest and said, 90% of us don't understand it.
Yeah.
So NHS England very graciously offered at all systems £35,000 in January to say, look, for those of you who are stalling a bit, we can help you. So we brought in some experts from third-party consultants and say, what, we don't think this will work for us. Actually, this plan, we think it's it's too complicated, it's not personal enough, and it'll just be a plan. It'll probably sit on a shelf, to be honest. And the various partners within the plans will deliver what they've done, and then in a year's time we'll say, oh, you've done it, brilliant, fantastic. But it's not going to move any mountains.
So have you got to the point where you've honed it down and you've got a sort of a list of priority sort of headlines?
Absolutely. So you
want to take us through them?
Yeah, sure. And I'll give you some of the highlights of the stuff that we've agreed to do. So because some of it's quite scarily exciting, but we can do it, I'm sure. So we brought it down into 9 different chapters, which was around workforce, models of care, digital transformation, travel and transport, estates, medicines, supply chain, food and nutrition, and adaptation. But more importantly, or as importantly, I suppose, our staff said, let's get those actions down. And we've now knocked it down to around, it's an argument, it's 17 or 18. We haven't decided on the 18th one yet, but it's 17. But some of those things are really, really exciting and are very explicit. And I think that was what the second version of our plan has got, which the first version of our plan didn't have. It wasn't explicit enough, wasn't smart enough, didn't say we're going to achieve these things. So our plan is.
Could you give us an understanding of maybe a couple of the actions that really excite you?
Yeah, sure. So mandatory green training for all staff. We haven't got that in a minute, not mandatory. So as part of our passport of mandatory training each year, mandatory training for all staff under the ICS umbrella, which include local authority staff and include trust staff. A green staff suggestion scheme. We've never had that before. With a budget attached to it, unbelievably. So a green staff suggestion scheme where people can suggest these are the things that we think can make a massive difference. We're going to make a real public proclamation of how we flexibly work in the future. COVID has obviously changed the world on how we all work, but there's still nothing there really to say, well, actually, as a system, we are going to continue working in a specific way. We are going to make an explicit statement about what we expect of our staff, and what we'll expect of our staff is you won't have to travel to work as often as you used to. And in some circumstances, you may not have to travel to work at all. We're going to use a co-share as our search engine across the piece. So at the moment, a co-share is a green-friendly search engine, which promises to plant trees every time it gets hit. We're going to change from Google, etc., to a co-share. Cycle to work scheme availability for all staff. It's not at the moment. That's not there. Our lease car scheme will only be able to purchase battery electric cars and ultra low emission cars. We've got a green car scheme in some of our places in the county, not all. A complete root and branch review of how we purchase our energy and where we purchase our energy from. And probably the one that's, I think, going to make the biggest difference, we're going to keep the pound where we can in Devon in terms of our supply chain and procurement. Because at the moment, I mean, once some of our trusts currently buy our food in Scotland. And we would hate to think that would continue after we have our green plan, when we have a county in Devon that produces as much good food as anywhere in the country. And yet we decide to ship it down from 450 miles away.
Please don't fall out with the Scots, though, will you?
Oh no, they're lovely. They're lovely, but
be nice,
yeah, I'm sure we can buy some things from Scotland that you can only get in Scotland.
Can I ask, because this sounds terrific? It's just the sort of practical, grounded stuff that our members listening today will be, big fans of, I suspect. And you can bet there's a whole load of people noting stuff down with a view to then copying it, which is always the best thing to do. How much of this have you arrived at any kind of a costed financial approach to is this cost neutral, or is there some investment that needs to be made? How have you arrived at the financial repercussions of this?
We've had some of our finance gurus looking at this, because it's not my world at all. There's going to be a small cost, but only a small cost originally. So very small 5 figures, we think. Sorry, high 5 figures, small 6 figures. So less than £100,000 investment. But the return on investment, we think within 5 years will manifold that several hundred times. So original investment. Yeah. I mean, for instance, one of the things we can do, John, is we haven't got any dedicated staff for this from the ICS. We're going to pay for a member of staff to dedicate their time at least for the first year, to project manage this to make sure it gets off on the right foot.
And they'll
because
have
again,
some kind of responsibility and accountability then as well, I'm guessing.
correct, yeah, and they'll have a seat at the exec level as well, so we are able to actually have exec level ownership of this as well as staff. So yeah, absolutely. So there will be a bit of cost, but if we don't do it, the cost will be even higher, wouldn't it?
Could I ask about infrastructure in Devon? Because you've talked about, you've got 4 NHS trusts, you've got 2 local authorities. They will be looking at their own operations at the moment. Some of those hospitals like Derriford and so on in Plymouth and so on, these have been around for some time. They will have infrastructure that is wedded to old-fashioned forms of energy, for example. Does the plan address the infrastructure challenges as much as it does, for example, the more straightforward things like we're only going to invest in lease cars that are carbon neutral, for example?
I think it's a tough call, John. I think at the moment it's very much a plan that's trying to invest in hearts and minds. I think we're taking baby steps to a degree. There are conversations, of course, there's conversations, but you're quite right. There's legacy, there's money. Let's be honest, there's finance, and that's tough. The good news is we've got the right people around the room to be able to discuss this in a mature way and express reasons why some things will take longer than others. But the plan we've got, we intend this to be a 10-year plan. So it's going to be, some things will happen very quickly, and low-hanging fruit will be able to be picked quite quickly. But some things will take longer term thinking.
Well, I think I'm sure you'd agree. This is all about, in my view, all of these initiatives, they're all about momentum. They're all about creating a worthiness that people get behind, and they're able to see some early wins, and you develop from that a commitment and a sense of shared success. And then you can build as you move along. And actually, when you come for the really big ticket items, then they don't look quite so onerous, because you've kind of proved in your own mind that you've already started to make some progress.
And we're really lucky, John. We've got some really enigmatic leadership in Devon. We've got some really strong chair, really strong chief executive. And the quotes that are coming out from those people are saying things like, we all got behind COVID and we all pointed in the right direction. This is the next thing we need to get behind and point in the right direction for all of us. So I think there's momentum. It'll take time, of course, but there's real drive to make it happen.
Could I ask about how one of the key things, if you're going to make progress, if you're going to make a success of this, I always look at change management. When you're asking people to change behaviors and so on, I teach it in our high performance leadership series. We talk about these 3 criteria, these 3 levers to pull: prize, belief, and pressure. So you put in people's minds who you're asking to change behavior, you get a real sense of what the prize is if we do this. The second thing is you fill them with an absolute sense of unshakable belief that it can be done. And the third thing is you apply a little bit of pressure that over time turns into peer pressure and colleague pressure, and actually, that pressure maintains the momentum. But for me, it's all about success. It's how you use those 3 levers, and then you show people every day, every week, every month, the progress that's being made. How have you approached this business of sharing the data, sharing the information, showing you must have tens of thousands of people working within the ICS who you need to engage with on this topic? How are you hoping to share information on a real-time basis so that it's meaningful and you can talk about your successes?
It's almost as if you teed up the question, John. Thank you. And we have never met. I can honestly say it's like a magician's assistant.
It's only a matter of time. Only a matter of time, Darin.
We're really lucky. We have a staff webinar that goes out live once a fortnight to all ICS staff, which hits in low figures. It hits small thousands. In high figures, it hits more than that. We have a green space on that, so it's a 2-hour webinar where we talk about everything and mostly COVID, to be honest. That's what it is at the moment. But we have green champions who have a green slot. So there'll be 2 things there. One will be the fact of the day. These are the things that are really interesting. With did you know that? Da 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 da. Could be anything, but want to be. This is the responsibility bit. This is the bit that we're trying to do. And what are you doing to make it happen? The Kitchener approach. What are you doing for your country, sort of thing. So yeah, we've got a sitting duck audience really sitting there waiting to listen to this, which is great. We're really lucky. I'm not sure all systems have that.
Is there any ambition in respect of real-time data? Because there'll be people on this conference this afternoon who'll be looking at their own organisations, and one of the frustrations that they'll have is this business of real-time data, so that it assumes basically the same kind of real-time data priority as things like finance or workforce or vacancies or recruitment or whatever else it might be. You get the gist here, you know.
Yeah.
Because
yeah,
without that real-time data, the danger is it can't maintain its priority level that we've all already talked about this afternoon.
I think it will come, John. At the moment, I think, again, talking about baby steps, I think we're looking at real-time stories, I think, which will then lead to hard facts. I think at the moment, we haven't really got the system in place to be able to do that as quickly as we would like, but we have got the system in place where we've got people who can let others know of the impacts that they're making in their world. So I think
you're talking sort of a best practice. Here's the positive impacts of some stuff that we're doing here. Here's some lived experience activity that kind of brings it alive for people and enables others to feel empowered and confident about either copying or doing something of a similar ilk. Would that be fair?
Yeah, but it'd be lovely to have real-time data in the same way we work with things like population health management. I don't think that's too big an ask, actually. I think
it's not. No, it's absolutely not. It just requires a determination to figure out what are the things that you are going to measure.
Sure.
Now, that's an interesting question, I suppose, actually, isn't it, for the ICS? If we're talking about a greener care plan, what are you going to measure? What are the absolute fundamentals of this? Have you any thoughts in that regard?
One of the things we are going to do is, and we're still pushing it through, is to have in all of our appraisals, what have you done to meet the green plan? What have you personally done to meet?
So you're going to make it part of the appraisal process across the ICS?
Yeah.
That's
cool.
That's neat. I quite like that. That's a new one.
It will probably be written on paper, which defeats the object a bit, but we'll try and but the plan is to have in the same way as we had how are you meeting the long-term plan of the ICS, well, how are you meeting the green plan, because it's a priority. So.
Perfect. Has there, just because I want to open this up for some questions from the audience, have you done any benchmarking where you've kind of got some key data measures of key elements, like, for example, if we're trying to get to carbon zero by 2040, let's understand what our carbon footprint is at present. Have you managed to get any data gathered in that regard?
That's why I need a project manager, John. That's why I'm advertising for one as we speak. So no, we haven't, but that's because and I think this is the biggest rabbit hole, I think, is we don't have anybody who does this full time for the ICS, and it needs that level of devotion and care. Most of us are doing this in the 5% spare capacity we've got when we've got it.
Yeah.
It needs dedicated resource. So I think it was the biggest decision we made as a system, that we're actually going to pay somebody to do this full time, and I think we'll see the rewards from that really, really quickly in quite a short space of time, because at the moment we've been skimming the surface.
Yeah, isn't it interesting? I mean, it's telling that you say you're trying to, you enthusiasts are trying to do this with 5% of your spare capacity, in inverted commas, and you need a project manager. And, I would look at this and thinking, a geographical area the size of Devon, with 4 NHS trusts, 2 local authorities, heaven knows how many private providers of social care, for example, an annual budget that must run into the many millions, if not billions.
So many deficits, John, unfortunately.
I didn't want to take you there. Didn't want to take you there. But this warrants more than
Yeah.
You know, well-intentioned people donating 5% of their available capacity and a project manager. Do you think you'd be able to press that button?
Yeah, well, we do have all the sustainability. We have a team of 9 sustainabilities, probably more than that actually. But the danger was it became an estates plan, and we didn't want it to be that. We wanted it to be much more humane, I think.
Perfectly put. Okay, let's ask our audience here. Always dangerous when you go to the audience. You never quite know what's going to occur. Has anybody got any? Excuse me. I'm just getting over COVID, in case anybody wonders why I do have the odd little cough here and there. I am negative now, by the way. Anybody got any questions they might like to ask of Darin, or any observations? So Thomas has said, are there any challenges for the Devon ICS specifically to implement a new green strategy, or any strategy, given that 2 of the trusts are merging tomorrow, so have had to be setting out their own new agenda? That's a great question, Thomas.
Good knowledge, Thomas, as well. Good knowledge of Devon. No, we're really lucky that certainly the 2 trusts you're talking about are 2 of our more progressive trusts in terms of their green plans. So I think, I mean, it's a bit of a wait and see, as you know. They only go live tomorrow, I think. So yeah, you're quite right. So at the moment, no, we're not, and we haven't seen that to be a problem. But I guess that will come out as plans emerge. But I don't think, looking at the 2 plans they already had, they weren't massively dissimilar anyway, to be honest. So I think it'd be quite easy to merge those 2 trust plans into 1 trust plan. But as I hasten to add, as I said earlier, we didn't want our plan to just be an amalgamation of the trust plans. They're going to do that anyway. We want it to be sitting across the top of it with some far-reaching ambitions for the whole of the system.
Perfect. I've had a text through. Could you just read out the 9 headings again? We got some of them down.
Shall I put it in chat, John? Would that be easier?
Would you mind? That would be absolutely fantastic.
When I finish wrap it in on, I'll put it in the chat.
No, that's fine. That's fine. So Patricia says, are you happy to share what you've done? I'm presently trying to set up a sustainability group for guys at St Thomas's. Woohoo! Let's hear it for them. ICU, which will include RBH, Evelina and Harefield ICUs. That's fantastic, Patricia.
Yes.
The answer to this is yes, Darin.
Yes, of course, Patricia. Absolutely no problem at all.
And you are very welcome, by the way, to use the special interest group within the IHSCM as a focal point for this activity. You know, that seems like a really good idea, to make Elaine's chairship of the special interest group. You know, part of that responsibility would be collating all of this different information. There you go.
So I'm answering the question now.
That's right. You go for it.
Is it in partnership with local authorities? Yes, Peter. All 3 local authorities. We've all 3 have been heavily involved all the way through, so it's fantastic. And then Toby, have we managed to get senior leadership directly involved in helping us to push this onto management agendas? Yes, quite simply. So our senior leadership have expressed that this is their priority, one of their priorities, along with finance, etc. One of their priorities for the next 12 months. So yes, it's on. It's being pushed from all directions, including the trust CEOs as well, and certainly our local authority leaders, particularly in Devon County Council, are massively involved in this agenda. So yeah, we're really lucky. We've got some terrific leaders in the county.
How will you personally, Darin, you know, if we fast forward a year from now, how will you personally reflect upon, are we making the kind of progress we want to or not? What are the key criteria you'd set yourself?
It's really simple, I think, John, because I'm sure most of us have been in the same position where we've written plans and we think it's, you know, the next Ulysses by James Joyce, and it just ends up not being that at all, and ends up. Do you remember that thing that he wrote ages ago? I don't want it to be that thing that he wrote ages ago. I want to be something that people can almost say, oh yeah, this is plan number 6, isn't it, for the green plan? I want it to be a living document that people don't just see as a piece of paper, but it's actually a way of being. That's hugely ambitious, I know, but
no. Well, and we'll help you with it. You know, we've got IHSCM people who will contribute as well, I'm sure, you know, from across the country. So please don't feel that you're on your own in Devon here. I think the more we collaborate and share information and ideas, the better we'll all be. So good. Okay.
Peter asked, have we learnt from others? Yeah, Dorset are really good, I have to say. They're on our doorstep as well, which helps. So they've been doing some really cool and crazy stuff. So I've got a direct link into Dorset. They've been really, really helpful. But I mean, that's probably just very local. There must be absolutely loads of great stuff going on, which I'm sure that people can tap into.
And you'll have seen Lorna's question by now. Lorna, great question. What do you see as the greatest challenge?
It's about priorities, Lorna, for me. So 2 years ago, if you'd have said that we'd face what we faced. So it's making sure that the green agenda is up there in terms of the focal point for people's actions against a very challenging environment. I think that's going to be the hardest bit. I think make sure it doesn't get lost in the long grass, because the grass is not getting cut as often as it used to be.
No, and as we said at the top of the show today, you know, you think of all of the suddenly competing priorities, inflationary pressures, energy costs, financial pressures for the ICSs in terms of a harsh environment for breaking even. You know, there's going to be stuff thrown at organizations of any size that actually they couldn't have predicted even a year ago. And
also, sorry. Yeah, and also, John, at the moment working on a workforce that's 80% there because 20% are off.
Yeah,
because of the dreaded
don't get me started on workforce right now, Darin. It's just a long-running sore, as any observer of some of our output will have said. Any final questions? We've got Victor. Victor's joining us from Nigeria. Hello, Victor. Lovely to have you with us. I think he's been along to one of these before, so great to have you along anyway. Take any final questions for Darin, please. Feel free to unmute. We would love to hear some other voices here. We'd be lovely. Feel free. Okay, Darin, if people would like to contact you, perhaps you'd be generous enough to put your email contact details in the chat. We'd love you to full-time join our special interest group. And if any of you watching and listening would like to join the special interest group, which really is the group that decides what content you want us to create within the Institute, then do please pop your email address in the chat, and Jade and Elaine will pick that up and make sure you're invited to the next meeting. But that's super, Darin. I'm very grateful to you. I know everybody listening here wishes you well. Everybody wants you to succeed. Please don't be a stranger to us. You know, tell us how you're getting on regularly and come and update us. Would you do that? Yeah, of course. Thanks. It's been a pleasure. Thanks very much. And I'll get typing away now. So. Good man. Yeah. So we'll get your contact details and your 9 headings. That would be super duper. Thank you very much. Take care, everyone. Thank you very much, Darin.